What is opioid addiction treatment? And everybody's aware of the opioid crisis. So opioids are painkillers, opiates, heroin, all in that kind of family. So it has become a crisis because people are now, because of the pharmaceuticals primarily. And so how do we treat that? So this one is pretty near and dear to my heart because I had a long time opiate addiction. I was taking 100 Percocet a day, every day for about 5 years or so with a bunch of benzos to go to bed. And moving through that, I was able to detox several times. I mean, many people with opioid addictions go through this detox process a lot, and that is so painful and difficult. Why do we keep doing it again? So it became apparent that we have to have a different model that heals the root cause. Why does a person go back after they're clean for some months and past acute and even protracted withdrawal? Why, 3 months later, do I go back again? Because I haven't resolved the underlying issue that was disturbing me in the first place. So in order to heal opiate addiction, we have to get to the root cause of why we're doing it in the first place. And that needs a holistic approach. So a traditional treatment model based on the 12 steps is about a bunch of protocols that you go through in your life, and they're often about just staying away from people, places, and things, which is great, but it's not a one-size-fits-all. What we have found is we have to go down to work on how does addiction live in your body, because it does. It's in the tissues of our body. It's in our bones. How does it live in our psyche? And psyche implies the unconscious mind. If you're really honest about it, when you ask a person why do they relapse after a year of clean, they don't know, because it's all unconscious. It's all in the psyche. And this is where all of our unprocessed wounds, all of our hurts are there. We have to get it out of our nervous system. So we have protocols at the Sanctuary to address the body, to address the mind, to address the underlying traumas, to address the psyche, to address the soul, the place of purpose and meaning. We've all heard about the hole in the soul. Well, we can only fill that up in a certain way. And we do that in a very sacred and pristine container. We serve the finest food. We have a functional medicine doctor as our psychiatrist. So this is not about just replacing one pill with another. It's not about going on Suboxone or Methadone. Those things might be very short intermediate steps to help with detox. But is it really the answer for a long-term lifestyle? Because we've seen people have huge issues coming off of Suboxone, and anybody that's tried it, any doctor would never prescribe that. So what we want to do is take care of it once and for all, getting down to the root cause. And in order to do that, we have to use a holistic approach because it lives everywhere in our body, everywhere in our mind, everywhere in our soul, everywhere in our spirit. And we have to work and heal all of those places.